Afternoon, everyone. We can get underway. Before starting out our conversations around the federal election today, I would like to acknowledge the lands that we are on. In the spirit of truth and reconciliation, Parkinson Canada acknowledges that we are gathered today on the customary and traditional lands of the Indigenous peoples of these here territories. While we meet virtually, I would like to take a moment to acknowledge the importance of the land which we each call home. I wish to acknowledge the land that I am on while we gather today. For thousands of years, it has been the traditional land of the Huron-Wendat, the Haudenosaunee, and most recently, the Mississaugas of the Credit First Nations. This land is governed by the Dish with One Spoon Covenant between the Haudenosaunee Confederacy and the Confederacy of Ojibwe and Allied Nations. This covenant is to share, work, and protect this land together in harmony. Together, this meeting place is still the home to many Indigenous peoples from across Turtle Island, and we're grateful to have the opportunity to work and live on the land. From coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people who call this nation home. And before diving in, I would also like to share some brief housekeeping items. First of all, there are going to be a number of links or documents mentioned in the talks today. And so following the webinar, we'll make sure to email out so that you have access to all of these. The webinar is also being recorded, and the recording will be made available on our website and shared with you so that you can then share it out with your friends. We realize that it has been very short notice since the election was called last Sunday, and we appreciate all of you making the time today to be available for this. At the end of our session, there will be a Q&A period with questions for all panelists and content up for discussion. So if you have questions along the way, feel free to post your questions at the bottom of the screen with the Q&A box. We will only be able to focus on questions today on the topics at hand. We are not election experts. And if you do have questions that are of a personal nature, we'll do our best to email you directly with those questions. Before introducing our first speaker, I want to kick off this webinar with a poll for everyone in attendance. And so the question is, in your opinion, what is the top election issue or priority for this federal election? So you'll see the options of healthcare in general, COVID specifically, the economy, climate, or other. Just interested to see what each of you think or what the leading issue is going to be for the next few weeks. And I'll give it another 30 seconds for everyone to vote, and then we will share the results. Great. Hopefully each of you have had the chance to vote. Lori, I'll let you end the poll and show our results. So you should be seeing this on your screen. Healthcare did come in at number 1, but really there's a wide spread of people who think also that COVID, the economy, and climate are going to be the leading issues. And we got it peg on with this audience thinking that those are the 4 leading issues for this election. And with that, I'm glad to introduce and welcome Parkinson Canada's CEO, Dr. Karen Lee.
Great. Thanks, Cameron. I think in the poll, economy edged out just by 1 vote, but it's pretty clear it's very similar to healthcare, which is an important topic for us at Parkinson Canada. And I just want to thank Cameron Duncan, who didn't get to introduce himself, but he's our Director of Strategic Initiatives and Communications. So thank you, Cameron, for kicking this off. As Cameron said, a federal election has been called for September 20th, 2021. And in the lead up to this election, we are asking you, members and supporters of the Canadian Parkinson community, to reach out to the electoral candidates and the candidates in your local riding, to call upon them to prioritize Parkinson'S. And we are going to learn more about how to do this today. This is a very quick election, just over 30 days, and there are a number of big issues. Like as we just talked about in the polling, there's environment, COVID, economy, but there's also the complication of conducting an election during what we are now in the fourth wave of COVID. In spite of these competing concerns, it is critical Parkinson's and the need of our communities have a place in the conversations. Many of you have heard now that the rallying cry for Parkinson Canada and for our community is no matter what. It really reflects the unwavering spirit and determination of the over 100,000 Canadians with Parkinson's. Throughout this election, we are channeling this determination and are committed to raising the voice of people affected by Parkinson's. It is time Canada recognized that the healthcare outcomes need to be improved across the country for the Parkinson's community. Over the last year, I've had the privilege to lead the organization through a listening tour across the country to learn from people living with Parkinson's who are impacted by Parkinson's. I've appreciated the opportunity to hear about the issues impacting the Parkinson's community directly from the community itself. You've told me about the challenges that exist through diagnosis. The process can be quite long, the barriers you've encountered in assessing care, and our research and clinical teams have also described the variability of care across the nation. So someone in BC may not even have the same care as someone right next door in Alberta. This election is the opportunity to have your voice heard and make sure your elected officials are aware of the importance of issues surrounding Parkinson's. And we are here to support your advocacy work by equipping you with the right tools. During today's webinar, you will hear about some of the key issues for Parkinson's. Our recently launched election website features an online platform you can use for speedy candidate engagement. It's pretty cool. I just saw it myself. And you can also use the hashtag that we're using, which is #PrioritizePD. We're going to use it on social media, and we also will be providing bilingual offerings for those of you who would also be more comfortable in conversing in French. In addition to supporting your advocacy, we at Parkinson Canada will be conducting our own outreach to elected officials to help raise the voice of people with Parkinson's. Parkinson Canada, we recognize that we are much stronger together, and we stand united with Parkinson Society British Columbia, U-Turn Parkinson's, and Parkinson Society Newfoundland and Labrador. We're also glad to have the support and engagement of Parkinson Association of Alberta, Parkinson Society Southwestern Ontario, and Parkinson Quebec, supporting our advocacy efforts overall. And now it's my privilege to introduce our first speaker. Many of you may know Dr. Sonia Mather is a family physician who's living in the GTA of Ontario. She recently resigned her clinical practice 12 years ago following her diagnosis of young onset Parkinson's disease at the age of 28. She is now a dedicated speaker, writer, educator, and a Parkinson's advocate. Dr. Mather is an active speaker in Canada and internationally at patient-centered conferences and has authored a number of published papers and online pieces that focus on patient education and empowerment. She serves as the co-chair for the Patient Council of the Michael J. Fox Foundation for Parkinson's Research and is also a member of the Executive Science Advisory Board at the Michael J. Fox Foundation. She also devotes time as a member of board of directors at the Davis Phinney Foundation, is part of the editorial board for the Journal of Parkinson's Disease, and serves on the Brian Grant Foundation Advisory Board. And on top of all this work, she recently co-founded PD Avengers, a global alliance of Parkinson advocates, and she is a founder of the Unshakable MD website, which serves a platform to educate and inspire those living with PD. So thank you again, Dr. Mather, for joining us, and I'll hand it over to you.
Thanks so much, Karen, for that lovely introduction. And thank you all for the privilege of speaking with you today. As Karen mentioned in the introduction, I'm a family doctor, actually. And I was diagnosed well over 22 years ago at the ripe old age of 28 with young onset Parkinson's disease. After about a decade and a few years of clinical practice, I retired and began my life of writing, speaking, education, volunteering my time with a number of boards and organizations. In other words, I went from what I thought was a busy general medical practice to an overwhelmingly busy life with Parkinson's disease advocacy. In the next few minutes, I just want to share with you why, to me, on a personal and professional level, patient advocacy is so important. And a couple of minutes on what Karen mentioned, PD Avengers, how they came about, that I co-founded with another couple of Canadian advocates, and the power that our patient voice has. First, how would you describe advocacy? Well, advocacy by definition, if you look it up in the dictionary, is an activity by an individual or a group that aims to influence decisions within political, economic, and social systems and institutions. In the case of patient advocacy, these aims would be directed towards patient-centric goals. That's the official definition. In reality, what are we talking about? We're talking about making a difference for this, our Parkinson's community. So do I think of myself as an advocate? Well, as I said, 22 years since my diagnosis, I think I can safely say that much of my time is spent in patient advocacy work. Serving the community in this way really and truly is my passion. But it really wasn't always this way. I mean, I was diagnosed at 28. I had just completed my residency in family medicine when I was expecting my first child, when I noticed that tremor in my right pinky finger. And so not the most convenient time to experience that. I went to see a friend at that time who was also a colleague. He was a neurologist who, after a quick examination, and this is unusual, I think, from the diagnosis stories that a lot of people share, but he diagnosed me with young onset Parkinson's disease. Needless to say, I didn't believe him, but I did accept his offer for a referral to one of the probably world's best movement disorder specialists in Toronto, who happened to be working at Toronto Western. And instead of exonerating me from that diagnosis, he unfortunately just confirmed it. So what should have been really a joyful and exciting time in my life was instead marred by this unwelcome diagnosis, this sort of unexpected trajectory that many of our lives take. And I would say for almost the beginning 10 years of my diagnosis, probably, I spent just throwing myself busyness, trying to ignore the fact that I had Parkinson's, just living in denial and fear. But mine is only one of millions of diagnosis stories. I mean, here in Canada, there are over 100,000 people living with Parkinson's disease, and 25 more individuals will experience their own diagnosis stories each and every day, all stories as varied and unique as each of us. Parkinson's disease is the fastest growing neurological disease in the world, and Canada is not immune to that growth. In fact, we have some of the world's highest rates. As the population ages, we expect this number to only continue to increase, and the disability and cost, which are both for individuals and society in general, will only get worse. This has to change. Something must be done. We as a community have to advocate for ourselves. We have to make Parkinson's matter. But advocacy is a journey. For most of us, it takes time to shift our focus from our own diagnosis and experience to that of our community. And how does this shift in focus occur? I don't know if you've heard of Tom Isaacs. He was a friend of mine. He unfortunately passed away a few years ago, but he was also the founder of Cure Parkinson's Trust in the UK. And he described that journey, the psychological journey that we kind of go through from the point of diagnosis to the point of advocacy, that he summarized in the advocacy pyramid. I'll just briefly tell you what that's about. The journey, as I mentioned, starts at the bottom of the pyramid, and that begins with diagnosis. Communication is the next stage, where we all sort of start to disclose to people around us, our friends, family. We sort of understand that communication becomes kind of therapeutic, and a burden shared is a problem halved, so they say. The next steps are acceptance, education, consolidation. This is a key stage, the stage where you begin to accept that you have a new normal, that you accept who you are, that you aren't the person you once were in many ways, but and undoubtedly life has changed, but you can kind of begin to concentrate on the new you. Once you're able to accept this disease and educate yourself about this disease, your focus then tends to turn outwards towards others within your community. It's a stage that we call engagement and participation. Your outlook now becomes a wider issue, not just a personal one. You start to engage with others, listen to their stories, understand that your own experience helps others when you communicate it. You become more engaged in the Parkinson's community. This might take the form of joining a support group, working with a specific Parkinson's organization, or even taking a particular interest in something like clinical trials. However you choose to participate, you go from what Tom used to say, from being needy to being needed. And that's the stage of advocacy. You begin to devote much time to the business of Parkinson's. It becomes your focus, your passion. Your goals are to help your community in search for better treatments and a cure. The stage of advocacy is a time of influence where your input, and you're here today, but your input can impact patient care and policy through involvement with pharmaceutical companies, patient organizations, scientifically led initiatives, or in the political arena. It's all about making a difference on a broader level or even within your local community. And hopefully we reach the top of that pyramid. By uniting as advocates, by uniting all our efforts, we will ultimately reach the end goal, which is the cure. It is out of this sense of urgency to end Parkinson's disease that the PD Avengers came about, an organization that I co-founded with a couple of other Canadian advocates you may know of, Larry Gifford and Tim Haig. We're all inspired after reading the book. I don't have it here in front of me, but it's called Ending Parkinson's. It's an excellent book that just came out last year, written by neuroscientists and clinicians. And at the end of this book are a number of pages that are basically calls to action in terms of prevention, treatment, research, and that sort of thing. And as we kind of read through those calls of action, we thought, who was going to tackle, all the work that needed to be done? We recognized that there were lots of organizations, great organizations doing great work, but we're often working in silos. And we realized that unlike other disease groups, if we left things as status quo, we weren't going to progress fast enough. And as you and I all know, when you have a chronic progressive neurological disease, we don't have time to waste. I mean, Parkinson's was described over 200 years ago. Since then, humanity has put men on the moon, eradicated polio, changed HIV from a death sentence to a chronic illness, has mapped the human genome and discovered thousands of galaxies among the stars, and yet has really provided precious little beyond that one gold standard drug, 50-year-old drug for Parkinson's disease. There are others, but they're all measured against that one gold standard, which is 50 years old. Despite the unprecedented advances that have been made in the areas of technology and medicine, Parkinson's disease remains a source of disability and poor quality of life for millions of people with PD around the world. So we pulled together a group of founding members and launched PD Avengers. It was actually a name that began a bit tongue in cheek, but ended up sticking. And that came into being in July of last year. Already we have 3,600 PD Avengers from over 70 countries globally and 56 partner organizations, including Parkinson Canada, who all subscribe to the same sort of mission that we have to end this disease. We've kind of unified ourselves around 3 pillars. The first is wellness. We believe that everyone, regardless of where they live, deserves access to care. All people of the world with Parkinson's need to have access to proper medications, treatments, information, and support. Even here in Canada, with all the resources we have, it takes far too long to receive an accurate diagnosis of Parkinson's disease, up to 2 years. I would hazard a guess that might even be longer if we think about prior to diagnosis, how long our symptoms were in existence for. And that's much too long for people with symptoms living with that uncertainty and lack of appropriate treatment or advice, not to mention the effects on families of those experiencing the symptoms. So wellness is an important thing. The second pillar that we sort of work around is advocacy, much like you're doing here. In PD Avengers, we hope to unite a global group of actively engaged advocates to power forward unified campaigns to raise awareness for a mission of ending Parkinson's disease. But that's to think global, but act locally, as we're doing here today. And the third pillar we work around is research. We need to support our hardworking research community. We aim to improve meaningful Parkinson's input at every step of therapeutic development, which we believe will accelerate the development of treatments directed towards the most urgent patient needs. And patients know that best. And that requires an increase in funding. So PD Avengers is patient-led. We're not fundraising, we don't fundraise, but we partner, we don't ask for money, but we do partner with organizations to amplify existing missions and existing campaigns by sheer numbers. So how does this relate to what we're talking about today? Well, an important tenet for PD Avengers is to think global, but act local. It's important to do whatever we can to unite on a global level, but to act locally, customizing our approach and working closely with appropriate groups to support efforts that are compatible with our mission. I mean, the work that we do with people in Uganda who don't even have access to basic dopamine replacement is going to be different than the mission or the campaigns that we support here in Canada. So, but overall, we're advocating for Parkinson's disease to matter to governments and other stakeholders that can make a difference. With each passing day and those that we love face a future of uncertainty and an increased burden of this disease. We know that there are many stakeholders that are working really hard to make Parkinson's disability a thing of the past. And we're grateful for that, but we are getting increasingly impatient for progress to be made. So think globally. If you're a patient, a care partner, a clinician, an allied health professional, a researcher, you're involved with pharma, or you're just someone who cares about this issue, we need your support. You can visit pdavengers.com to sign up, support our efforts, and learn more about our work. And act locally. Find out how you can work with local organizations like Parkinson Canada, how we can all work with Parkinson Canada to affect change here at home, help them in their advocacy work, to raise our voices as we gear up for this next federal election. And we're going to hear lots of great ways to do that today. Through all of us working together, by uniting our voices, supporting campaigns that align with our vision, amplifying those voices, focusing each of our efforts into a powerful voice and force for change, we can and we will end this disease. Thanks so much. I look forward to talking to you during Q&A.
Thank you so much, Dr. Mather. It's always such a pleasure hearing you speak and you sharing your experience and success advocating for the Parkinson's community. Is just a great way to kick off our discussions about the key issues relating to Parkinson's during this election. So thank you so much.
Thank you.
Thank you. Hi, everybody. My name is Amanda Stanton. I'm the Director of Public Affairs and Partnerships with Parkinson Canada. I'm relatively new to this role, but I've been with Parkinson Canada for well over a decade, working in community, in support, education, in fundraising and events, and now specifically working on our advocacy efforts. And needless to say, I've come into this at a very busy and exciting time. So we've had a lot of discussions throughout the summer about what our election strategy would look like, but really up until last week, our primary focus had been on our roundtable sessions, which is a series of meetings that we've been having with the Parkinson community and healthcare professionals and government representatives from all across Canada. Now we're partway through this initiative. And the purpose is really to capture the regional realities of healthcare so we can then build an overall strategy for engaging with all levels of the government. But as I mentioned, since we're just partway through, we're not quite ready to go with that larger strategy. So given that the election is less than a month away, Parkinson Canada's strategy for this election period is just to get Parkinson's into the conversation, start raising the awareness, ensuring that all of the federal candidates who will then become our elected officials are aware of the urgency of improving healthcare outcomes for people living with Parkinson's. So through the roundtables, actually 3 issues have emerged so far as most important to the Parkinson's community, which are diagnosis wait times, access to specialized care, and medical expenses related to managing Parkinson's disease. And we are just so fortunate today to have 3 members of the Parkinson community here with us today to speak about these issues in more detail. And we're actually going to start off today with diagnosis wait times, which we know are just too long in Canada. 1 in 5 people living with Parkinson's wait more than a year to receive a diagnosis after first reporting their symptoms. And we also know that these prolonged wait times to receive diagnosis can negatively impact an individual's quality of life. So here to talk to you today about his experience is Bryce Perry. Bryce has a combined 30 years of experience of coaching, training, motivating, and leading people. He has worn many different hats, from a general manager of a Fortune 500 company, leading 300 employees, to founding and running a nonprofit corporation in both Canada and the United States. He has had numerous radio and television appearances. He's a published author and has given keynote and motivational speeches to crowds of thousands. His desire and passion has always been to inspire and motivate people to live their best life. Then, in 2012, at the age of 42, Bryce was diagnosed with Parkinson's disease. After a few years of adjusting to his new reality, he founded Doing Life Today. He now coaches people with Parkinson's, encouraging, motivating, and reminding them that a Parkinson's diagnosis is life-changing, but not a death sentence. Helping people to make some lifestyle changes and keeping them accountable to those changes, Bryce has seen many people thrive in life, regardless of their disease. Bryce is joining us today from Winnipeg, Manitoba. And over to you, Bryce. Welcome.
Awesome. Thank you, Amanda. And it is awesome to be here. And it's a privilege to actually share with you today. Everybody's diagnosis, everybody's Parkinson's story is unique, but there are a lot of similarities in our diagnosis and our trip down that road. So I thought I'd just take a few minutes and kind of share my story, and you could pull out of that what you may. But as Amanda mentioned, I was the day of my 40th birthday, which was in 2010. I started getting just a tremor, a slight tick, I guess, in my mind at the time, in my right hand. My grandmother, the very next day, passed away at the age of 88, and she had been diagnosed with Parkinson's when she was about 68 and had it for about 20 years. Kind of interesting, coincidence that the day that I started kind of tremoring and the day she passed away coincided. I didn't think much about it though. I just thought maybe I was just stressed out. Maybe I had too much caffeine that day or something to that effect, and kind of just tried to ignore it. But as time went on, it continued, and I thought I better get this checked out. So again, that was at 40 years old. At the time, I had a young family, 3 children. I was an executive in a Fortune 500 company. I had just been promoted and really felt like life was really in a good place for me, except for this little tremor. So as I went on this journey again, so I went and started, going to my family doctor, and he said he'd refer me to a neurologist, which took, maybe 3 to 6 months to be able to see one. And for the first few visits that I went to, I was told that it was probably in my head that, I had this, it was a mental thing that I had because my grandmother had it and whatnot. After seeing numerous doctors and numerous neurologists, it took about 2 years before I finally was able to get a diagnosis of Parkinson's disease. When I got that diagnosis, though, it was kind of a weird situation because although it was scary, I finally had the answer. I finally knew why I was shaking, what was going on. So there was almost relief, a little bit of overwhelmness, but almost relief that I wasn't crazy. There wasn't something in my head, that it wasn't something I was dreaming up or wanting to have. And so it was, when I first got it, for the first month, I actually was kind of proud of myself that I kind of like, hey, okay, I figured it out. I got this set. All of a sudden, though, this reality kicked in. I'm 42 years old now. Again, young family, and I have a career. And now what? Now I've got this expiry date. Now I've got this disease that's going to get worse. And what's going to happen to me? Am I going to see my kids grow up? Am I going to be able to have a career? Can I still work? How long will I be able to work? Will I be able to walk my daughter down the aisle at her wedding? Will I be able to move that way? And these overwhelming thoughts just started taking over me. And as most of us do in this day and age, we have this handy thing called Google, and we start Googling, all the things that could be and should be and might happen, which is very overwhelming as well, and some information is great and some isn't great. And that's why I'm so thankful for organizations like Parkinson's Canada that has information that you can access and you can get the facts and you can find out what it really is. For me, it was difficult because my wheelhouse was speaking, and I started reading things that my speech might go, and and being up in front of crowds and talking and motivating people to live their best life. And I really went into kind of what I would say was a depression. I kind of crawled back for 2 or 3 years of just like, what was me and why me and how could this happen, and what did I do wrong and what could I have done better. And it took quite a long time, and it was very interesting because I've as Amanda said in when she introduced me, that I've always told people and I've always pushed people to live their best life. And all of a sudden, here I am with this progressive disease that I don't know what to do with, and yet I'm not living my best life. So after a few years of doing that, I finally came out of that on my own. I came out of the depression, and I realized that so many people, as I was talking to people in the Parkinson's community, and as I was talking, there were so many people that didn't really understand what it was. There were so many stories that are so unique and so different. But the reality is, one story, especially for young onset Parkinson's, is the one thing that was common across everybody I talked to was this fear of the future and the what ifs and what's going to happen and what should I do, and maybe I should just not do anything. So I took it upon myself now to be that person, hopefully for other people, to keep them motivated, keep them going, keep them wanting to strive to live that best life. And no matter what that speed bump might be, no matter what that is, that diagnosis of Parkinson's, it isn't a death sentence. It's something that we deal with, but we still have a life to lead. We still have people to lead and people to encourage and people to help. And that's what I've made my life mission. As we said, though, it took 2 years for me to go from a tremor to know that there's something wrong, to actually find out what it was. And, you know, with anything, the quicker we can get that diagnosis, the quicker we can get into programs, the quicker we can get into our medication, the quicker we can get to understand it. Because even when we get diagnosed, there's still a 2, 3, 4 year period of adjustment and trying to figure that out. And the quicker we can figure out what it is, the quicker we can get our life in order, the faster we can start moving towards it and realizing that there is a future, that we're not done, that we can help. So it is so important for us. And if we're not going to do it, no one else will. It's so important for us to get out and to raise the flag and let people know that we need quicker ways to get diagnosis, quicker ways to get information. And we need people out there that are sharing truths and also keeping us motivated and going forward. And that's what I wanted to share with you today. I thank you, Parkinson's Canada, for the opportunity, and look forward to any questions later on.
Thank you so much, Bryce. So inspiring once again to hear that journey from depression into now living your best life and coaching others to do the same. It's just wonderful to hear. And actually your comments about, you know, the quicker you get that diagnosis, the quicker you can get to that next step leads us very well into the next issue we want to cover, which is getting access to that specialized care that's so important for people with Parkinson's. As we know that for those seeking access to a Parkinson's specialist, the national average wait time is 11 months, with some regions experiencing wait times of greater than 2 years. As of 2021, it is estimated that there is one Parkinson's specialist for every 1,679 people in Canada living with Parkinson's. And this ratio does not take into account that many of these specialists are concentrated in urban areas, making the access an even greater challenge for individuals with Parkinson's in rural and remote communities. Our next speaker really knows these challenges well, so I'd like to introduce you to Jessica Brace. Jessica lives in Yellowknife, Northwest Territories, and her dad, Carl, was diagnosed with Parkinson's disease in 2013. At first, his symptoms were mild and managed by medication. However, the disease has progressed rapidly and medications are not as effective. In 2018, Jessica's parents moved up to the north to live closer to her and to have access to affordable Medicare, but at the same time, they moved away from the access to specialized Parkinson's care. So to hear more about Jessica and her family's story, over to you. Welcome.
Wonderful. Thanks so much, Amanda. It's my pleasure to be here, and I really appreciate the opportunity to tell our story to a bit of a wider audience. As you said, my dad was diagnosed back when they lived in Vancouver in British Columbia, and access to care there was a little bit more available at the time. After moving to Yellowknife in 2018, being in the territories, there are no Parkinson specialists up here. There's not even support groups up in the territories, so we're kind of on our own. I was really relating to Bryce's story about, Googling and how you're getting more information through Google than you are necessarily from your healthcare professionals. So once my folks moved up with me and we were considering what care they needed, I was on Google all the time trying to learn more, because I found here just getting a doctor's appointment was very difficult. The first few times that we attempted to get doctor's appointments for my dad, we were given locums or specialists or doctors that just didn't have a clue about Parkinson's in any way, nor did they know how to navigate the system in the territories to get us that care. We don't have neurologists in the territories, so it would be recommending us to wait until a visiting neurologist came to town. So when we first asked for support, the GPs we were speaking with just didn't understand what our requests were. At the same time, because of the move being so difficult for my father to contend with, his disease progressed rapidly and we didn't have any care change. We didn't know, do we up the medications, do we not? But what he was currently taking was not helping, was not actually supporting him in any way. And so when we would get care, we took about 1.5 years to get our first appointment with the neurologist when they came into town here. And the second appointment that followed that was about 6 months later, if not another year. That first appointment, before that, because we were having such difficult time with medication and his symptoms were just so bad, GPs were getting some sort of, I don't know, advice from someone to say up this and change that. So we were making changes to medication that wasn't actually supported in any way. And the symptoms weren't getting better. In fact, they were getting worse for my dad. He was getting to a point where walking was even more difficult. Just his ability to control dyskinesia was impossible. But yet we were being increased medication and changes weren't really being made by anyone who understood the disease. In fact, a number of the doctors in the offices were Googling along with us about what they thought they should be doing in terms of his care. And then we got to a point where we were able to see the neurologist. There was one that came into town. We had a 15-minute appointment. Immediately, the neurologist, who had some experience with Parkinson's, understood what we were doing for medication and that this was an absolutely crazy medical regime that we shouldn't be following. And he recommended something else, which was great. So we tried the new medicines. They seemed to be working a little bit, but as things changed, we just didn't have access to care. Nobody was able to give us that advocacy throughout his Parkinson's journey to say that, this is available to you, or these are what you have. It's the same old drug, just either increase it or decrease it or take it more often. It wasn't until COVID hit, and actually, believe it or not, it was one of the best things that could have hhappened to my father, because what that allowed for was access to virtual care that we never had before. So we could actually get an appointment with a neurologist through Zoom like we are right now, and he was able to get a diagnosis medical treatment. He was able to get recommended to the movement disorder clinic, which we didn't even know existed. And now through Alberta Health, we're able to access that service. Dad was recommended for the Do-A-Dopa program, which was super exciting for us. But even now, it took over 3 to 4 months to get the approval for the program. He was able to get the surgery done to put a tube in his stomach, which will then get the medication done through a pump. But it was done here in Yellowknife and it wasn't done properly, and no fault to our surgeons, but unfortunately they used the wrong tubes. We don't have a follow-up appointment in Calgary for him to make sure that we get the proper program set up. And so he has the pump working. He's actually now currently has the wrong size feeding tube in his stomach, which is fine, but we don't have care for it. We have no purpose for it. And the next appointment that we have is not until September 20th, where we will do a video chat with the movement disorder clinic to then hopefully get an appointment within the next couple months so that he can actually use that tube properly. So our story is ongoing. Diagnosis wasn't the hardest part for us. It's been getting care and honestly being able to talk to somebody who can help us through this journey, who can say, these are the options for you. These are the different choices that you have, because right here in the territories, we just don't have that. But I'm hearing that in Canada, that seems to be pretty common across the north or across the country. One of the things that I'd say that is one of my biggest concerns is that if I wasn't here, if I wasn't the advocate for my parents, I don't know how he would get the care he needs. And my heart goes out to any patients out there that don't have an advocate that is next door that can take them to appointments so that can help navigate the system. It's very, very difficult. I'm guessing throughout Canada, but definitely up in the territories, we just don't have the support and the advocacy that we need, and there's no support groups here. Anyway, I can go on for hours about this, and I'm happy to talk more during the Q&A, but I do appreciate your time, and that's our story.
Thank you, Jessica. Thank you. As you mentioned, your dad and your parents are so lucky to have you advocating for them, as so many people do not. And just for me personally, I'm just so encouraging to have such a strong Parkinson advocate in the territories. And we just look forward to working with you further on that. So thank you so much for sharing your story. So the third and final issue we'd like to cover today is medical expenses related to managing Parkinson's disease. As we know that government health insurance is the primary source of funding for surgical treatments and medications, but discrepancies in coverage contribute to inequitable access across the country. Without government health coverage, other financial supports are quite limited. 1 in 3 people with Parkinson's disease experience difficulty accessing insurance coverage. And without coverage, individuals on a fixed income may be unable to access healthcare services paid for out of pocket. In a Parkinson Canada Ipsos survey, close to 75% of people with Parkinson's indicated they pay out of pocket for physical activities and exercise programs, and nearly 50% indicated they pay out of pocket for physiotherapy. So we're looking forward to hearing insights on this from our final guest speaker today, who is Ian Robertson. Ian recently moved to the village of Broderick, Saskatchewan, and was diagnosed with early onset Parkinson's in May 2012. In his personal life, Ian has been a lifelong entrepreneur in the hospitality and hockey industries, including working with the Saskatchewan Hockey Association through his goaltending training programs. Since receiving his diagnosis, Ian has been vibrating with excitement and generously documents his experiences through his Parkinson's My Superpower website. In 2017, Ian founded the Outlook Parkinson Support Group and has presented at support groups across Canada as well as in Iceland. Welcome, Ian, over to you.
Thank you very much. So we've been diagnosed with Parkinson's, and there's a few questions we now have to ask ourselves. A couple might be, can I afford this disease? And do I need a good financial planner? You may realize that you may not require immediate intensive care, but you are going to get some expensive care. While Canada may have health care, one must understand that health care is managed by each province. Thus, healthcare and the expenses involved vary from province to province. I knew I might experience trouble with Parkinson's long term when I started getting get-rich-quick cards from my friends. I've been self-employed for over 40 years, and this has helped shape how I view my Parkinson's, and of course, the expenses that come along with it. If the money's going out, it's an expense. But think of your expenses in 4 ways. 1, fixed. 2, recurring, 3, non-recurring, and 4, whammy, the worst kind of by far. Examples that fit into these categories could be medical, travel, gas, parking, physical therapy, dental, optometry, food, dietary, living accommodations, anything that plays a role in how and what you use to combat your Parkinson's. Another area of concern I've encountered in expenses incurred by my failing physical skills. I used to be quite handy around the house, attending to small electrical, plumbing, and mechanical issues. Not so much anymore. I now have to pay for that kind of task to be done. Everything adds up, and you question, what constitutes a medical expense? Are you entitled to a tax refund for your medical expenses? And which medical expenses can you claim? I get a massage about once, if not twice a month. However, my massages aren't covered by my provincial health care. Utilizing knowledge of these issues can play a role in how your Parkinson's can affect you emotionally and therefore physically. A good accountant can be just as important in relieving some stress and anxiety issues you may encounter than that of a good doctor. I now realize that when it comes to expenses, they are not all financial. The emotional expenses can be just as daunting. When attending support groups, discussing and comparing Parkinson's expenses, either as a group or a one-on-one setting, can play a big part in getting information that helps you gain some emotional control of any expense concerns you may have. Invite your MLA or MP to speak. This may get them to research this disease, even if it's just a little thing like knowing that Parkinson's has an apostrophe in it. However, it will provide you an opportunity to express your concerns one-on-one with the people who make the laws, especially during an election when they want to be seen, especially around specific groups like ours. Expenses are varied as symptoms when Parkinson's is involved. Understand that Parkinson's expenses and the way we are able to manage them are just a multitude of things that trigger our Parkinson's symptoms. However, this understanding is just a method that we can use to help live a meaningful life with Parkinson's. My talk is short, but in closing, I'd like to use the words of one of my favorite aliens. I offer this adage, Parkinson's or not, live long and prosper. Thank you.
Thank you, Ian. You really set us up perfectly for the next part of the session, which is great, which is when we're going to outline how to take action this election. But thank you to all of our guest speakers today, Dr. Mather, Bryce, and Jessica as well, for really just highlighting why advocacy is so important, what those key issues are, the realities that the Parkinson community is facing all across the country. And I just hope everyone is energized as I am to take action and start, raising the voice of people living with Parkinson's across Canada. So before we move forward and outline all of the tools and resources available to help you get involved in this election, I think we're going to move to poll question number 2. Which Parkinson's issue is most important to you? Diagnosis, healthcare access, expenses, or all of the above? So we'll just give everybody a few minutes, or moments to make your selection. Our speakers so wonderfully outlined their experience with each of these issues. All right, just another moment, and I think we'll pull up the results.
Amanda, I've got 24 out of 31 responses. Would you like me to end the poll?
Oh, sure. Yes, please do so. Sorry, I should have given you the go ahead. All right. There we go. Perfect. Okay. Oh, healthcare access coming up as the top key issue, followed by all of the above, which is not surprising, expenses and diagnosis. So it really shows that, everything mentioned today is just so important to the Parkinson community, and we're really looking forward to showing how you can take those key issues and get them into the conversation in your local, in your ridings and your local communities. So over the past week, seems a lot longer, but it's just been just over a week now, Parkinson Canada team has been working really hard to get our election webpage up and running, and you will find that at parkinson.ca/election. I'm just going to bring it up in a moment to show everybody. But you'll find an overview of the key issues, links to all of the ways you can get involved. And, whether you have 1 minute to take action or an hour or even, multiple hours in the next few weeks, we have something for you. So I am just going to bring that up now. I'm hoping this works. Okay, so I believe I'm sharing my screen. I hope everybody can see that okay. This is the Parkinson Canada election webpage. As I mentioned, some of the key issues at the top. And really, this is the part that you're going to want to focus in on over the next couple of weeks, which is how to include your voice. And Karen touched on this a little bit earlier in when she spoke about the new digital engagement tools that we have available. This is really exciting. First time we've had something like this available. And there are 3 different options right on this webpage that you can take a few moments to send a message off to your local candidates and get Parkinson's into that conversation in your riding. So the first one here is letter to candidates. So really neat feature here is that all you have to do is fill in your personal information. So just your name, email, and phone, and your address of the riding that you're looking to get involved in, most likely your home address. And it automatically brings up all of the candidates that are running for in this federal election. Now, I will say that they're still updating. Some parties, of course, are still confirming candidates and getting those uploaded. I've even noticed just within the past day, a lot more candidates have been added, but should be relatively up to date as soon as you're on here. Brings up all the candidates. You can click who you want to send the message to. There's a great templated letter here that if you just wanted to go ahead and use that, you can, but feel free to make some edits to add some local flair to it if that's the way you want to go. And then you just hit submit letter here at the bottom, and that will go directly into the inboxes of the candidates that you select. So just a really quick and easy way to get your message into the email inboxes of those candidates. If you are if you're active on social media, as Karen mentioned, anytime you're active on social media advocating for Parkinson's this election, please use the hashtag PrioritizePD. And then if you are more inclined to use this tool here that we have, quick and easy, same thing, you fill in your information, and this will rotate out. We have a couple different suggested tweets. You can add, once again, your own local flair to it, or some information specific to your riding. And you just hit tweet, and then it goes direct to those candidates that it'll tweet at those candidates that you select. And then the last piece here, this one is super quick and easy. Like I said, if you only have 30 seconds or a minute, please visit parkinson.ca/election and just add your voice to our petition. Once again, this will go directly into the inboxes of those candidates that you select. So I'm just going to stop sharing this for a moment and pull up something else. Actually, one other thing that I wanted to cover. So for those of you who are wanting to connect directly with your candidates, so maybe looking at, actually building some relationships in your riding, doing some phone calls, maybe catching up with your candidates at local events. I know some are, hosting some more socially distanced events in some ridings. You can visit election.ca. Type in your address and postal code, and you can also get the information about your local candidates that way as well. Okay, I am just going to pull up the next piece here. Sorry, just give me one moment. Okay, I think it will flip over here. Okay, so on this same page here, you'll see the Download Election Toolkit tool. And if you just click download now, I'm hoping that's showing up for everybody. So this is available to everyone as well, right on that web page as I showed you, but I am specifically looking at you, Parkinson's ambassadors. I know our ambassador team has just done a fantastic job of raising Parkinson's awareness in their communities and developing relationships with all levels of government. And so if you're looking for an ambassador, or if you're just looking to get more involved, you might need some more in-depth information. So this kit is perfect for you if that's the case. In the kit, you'll find some more detail, some tips, tools, suggestions on how to work as a Parkinson's advocate in your riding, in your community. So I'll just scroll quickly through it here. Lots of great infographics that you can share, and just some information, as I mentioned, on how to, advocate in your local community. So that's that. I'll stop sharing there. The last piece I wanted to mention, for those of you looking to advocate, and Karen mentioned this as well, advocate en français. We are in the process of translating all of the materials that we've shared today, and we're going to make them available on the website very soon. But in the meantime, if you're really eager to get out there, reach out to me. We'll share my contact information, and I can get you what you need to get started. So with that, I believe we're headed into our final poll question, and then we will jump over into the Q&A. So the final poll question of the day, which is a follow-up to what I've just shared: what actions are you going to take in the coming election? send an email via Parkinson Canada with those great digital engagement tools we shared, make phone calls, send letters, post on social media, sign a petition, vote, the most important one, and rally your friends and fellow citizens. Just give everybody a moment to select. And Lorianne, I'll leave it to you to just make a judgment call on when to close that poll.
Sounds great.
So I hope everybody gets a chance to check out specifically those digital engagement tools, because as we mentioned, it's just such a quick and easy way to just get Parkinson's, right in front of the eyes of those candidates, because we all know that so much is digital now. Everybody's, on their email and on social media, and the more Parkinson's topics and key issues showing up in the inbox, the better. All right, I think we could probably end that. That's great. Thank you. Vote. Fantastic. Yes, voting definitely the number one action you should be taking. But so happy to see that the second one following that is send an email via Parkinson Canada. So really excited to share those tools, and happy now to send it back over to Cameron, who I believe is going to lead our Q&A.
Thank you, Amanda. And I would invite all of our panelists from today to turn on your videos so that we can see all of you. I have a number of questions sort of back and forth between some for the panelists and some very particular to the components that Amanda had shared. But I wanted to start off with a question for all of our panelists so we can hear from each of you. And the question is, have you connected with your MPs or elected officials, whether for this election or in the past? And how have the conversations gone? Any tips with how to go about that, or how you've gone about that? And so maybe, Sonia, I'll start with you.
Yeah, I mean, I've spoken with people in government, not my local MP per se, but have been involved with a number of campaigns. And every single time that they talk about what impacts these conversations, it's telling your personal story. I mean, telling a personal story, and it really is quite impactful for people here. People remember stories. They don't necessarily remember statistics or numbers, but they remember your face, they remember the story and how it impacted your quality of life, how it impacted your family life. So I would suggest that's one thing to do, is always personalize it and tell your story.
Thanks, that's great. Bryce, have you ever connected with government or used your story as a platform?
Well, personally, in this election, I just moved, so I'm just trying to figure out who they are. But I've actually made some contacts for next week, and I would agree completely with Sonia. It's the personal story. It just brings weight to it. So whether it's your story or someone you know or a relative, just to really kind of to get in there and get that emotion behind it would be awesome. So.
Great, thanks. Jessica, you come from the perspective of a caregiver. Have you used your father's story, or have you engaged on his behalf, or with your own needs and realities with government?
No, not as of yet. I do work for the government of the Northwest Territories, not in the healthcare area, but I do have those connections. And after hearing the conversations today, I do actually feel like I know a few ways that I might be able to send a few letters or make a few phone calls, just because once the territorial government is small here too, so you have access to some of the individuals that could help you with that. And I think that might be a way to go forward. I just haven't done it yet.
Right, and that's totally fair. I think definitely a journey, and yeah, something that I think that we're all learning and building into. Ian, do you have anything to share? Any insights or experience with advocacy?
Well, I live in rural Saskatchewan, and so I personally know our MLAs and our MPs because they come from our ridings, and so we're not just another number. We're a face, and he's a face to me, and so I come with an advantage, I guess, to be an advocate that way, because I know both or most of the people that are even running in my riding.
Thank you. That's fair. And yeah, I think all of us are going to have our own connections and ins and ways to do it. There is no one way to go about advocacy. You have to make it work for yourself. And I'm just going to read a comment from someone who just texted in saying that many people with Parkinson's are seniors and don't always have computers or are comfortable with computers. I don't even know what a hashtag is, nor what it's for, or how much it would be used. And so I really enjoyed this comment, Margaret. To answer your question there in terms of like, are there other ways that you can engage? Absolutely. And when you look through the election toolkit, there are sample letters that you could then copy out and handwrite or print off a letter and mail it in. We also give some guidance. You can find the phone numbers for MPs or candidates and give them a phone call. And sometimes those have a profound impact as well, outside of the social media or some of the other trendy ways that we've talked about here. My next question is for Amanda. As health is a provincial jurisdiction, not federal, are there examples of other health matters that the feds have helped in or been involved with?
Yeah, that's a great question. It's quite right to point out. It's often challenging to see how those, big bucket federal funding commitments can then translate into any movement or improvement on the provincial level. But we actually have seen some successful outcomes with some organizations with national strategies that led to coordination with provincial governments. So some that we've got our eye on or that we've been looking at, Diabetes Canada and their Diabetes 360 framework for the National Diabetes Strategy, HIV, cancer, as well as the Canadian Dementia Strategy, which was made a bill in federal government back in 2018. So at this stage, as I mentioned, we're in the building block stages with our roundtable sessions, as I pointed out earlier in the session. But what we've been doing is just being really proactive, been communicating with these other organizations to learn from their experiences, determine what we can then apply to our own strategy and approach in 2022 and beyond.
Thanks, Amanda. This next question actually works for all of you. You're all on the hook for this one. The question is, and there's two questions that I've put together. The first is what can the government do to support care partners and families with Parkinson's? And as a follow-up specific to Amanda, I'll ask if there's anything that Parkinson Canada is doing to advocate for caregivers. So I'll flip up the order. And Ian, I'll start with you. What do you think the government can do to support care partners or families? And maybe from insights from some of the roundtable conversations you've heard as well, what do you think should be advocated for or that the government could do?
Geez. The biggest thing I would go for is to understand that, as much as we're going through the disease as a patient, I'm not going through my disease alone. I'm going through it with her. She's suffering as much as I'm suffering. And, how do you correlate that or join whatever financial package they're trickling down to the provincial body as to what goes where and support. I honestly don't know, Cameron.
And that's totally fair. Thank you. Maybe I'll open it up. Sonia, Jessica, Bryce, do any of you have any thoughts or anything that you'd like to contribute to this? And I won't put each of you on the spot unless you have something that you would like to share.
For one thing, I just want to say that care partners deserve a huge debt of gratitude. I mean, I've often said that I'm strong enough to bear this disease, but really I don't think I'm strong enough to witness it in a loved one. The amount of stress that they go through and the choice for them to follow us along this journey is really amazing. I think the price that unfortunately care partners pay is one of exhaustion and not getting a break. So I think there's a couple of ways that maybe the government or Parkinson Canada can advocate for. That's increasing community resources that are available for home care, for instance, in advanced stages of Parkinson's disease, or supporting exercise classes, physiotherapy, lifestyle issues that a person with Parkinson's can implement in their lives in order to improve their functioning and their quality of life. And the second thing is respite care. People need a break. You know, as much as you might love your loved one with Parkinson's disease, everyone needs a break to just concentrate on themselves, their own self-care, their own socialization, and that sort of thing. So those are a couple of things that I think are important.
Thanks, Sonia. Jessica, yeah.
I want to echo that, and thank you for mentioning them, Dr. Mather, because that's exactly right. Having access to home care and respite care that isn't just in the hours in which Monday to Friday, 8 to 4 that they work. We have access to respite once a week for an hour, which is lovely, but that doesn't quite cut it. And the difficult times that my dad has in his current situation is in the evenings. So often a home care is sent away when they come on, Thursday at 1 o'clock in the afternoon. See you, we don't need you. But in the evening, my mom is left alone with taking care of my dad and trying to manage moving him and helping him. And that's just the reality. So if we wanted to have overnight care of any kind, there'd be a personal cost to that. And I'd actually, in the territories, I don't even think it's available. But in addition to that, I think any opportunity to make this easier on both the patient and the caregiver is what I'd advocate for. Having a pathfinder of some sort, having a person to talk to once you get that diagnosis to say, now what? These are the things you need to understand and consider about this disease. I figured that out. My mom figured that out. My dad figured that out through Google and through trial and error. Nobody told us about the depression. Nobody told us about the anxiety. Nobody told us about the additional pieces of the disease that, is not just shaking. It's not just tremors. And we had no idea. So when we had the Parkinson's diagnosis, we thought there's to be some shaking and that's it. And that is the least of my father's issues. But we also don't know who to ask about. And it wasn't until, you heard my story years in that we even knew that a movement disorder clinic or movement disorder specialists existed, let alone, and it was because Google said, you should be making sure you have contact with your movement disorder specialist often. I'm like, often is once a year, if that, and we didn't even know it was a thing. So having some sort of pathfinder or support group that can actually assist a family through this disease, I think would be one of the biggest things. And then that means, personally, I think it has to be across Canada, and it doesn't need to be provincially or territorial limited. You don't need to have it just for your territory. If there's someone that has this information in Quebec, great, let's access them. And we have, as we are right now, we have the access through technology. So what can we do in that vein to go across or pan-Canadian in that regards, right? So I think any sort of support and pathfinding would be amazing.
Thanks, Jessica. And Bryce, do you have anything to add there?
Yeah, I echo exactly what everybody said, but I also think there's also the mental challenge as well, the physical, the respite. As much as us that are going through it and having all these questions and thoughts, if you're not in if you don't have a health plan or anything like that, I mean, there's counseling, there's so much things that are going on in a spouse or partner that they need counseling, they need help. What's their future look like? How could they, where can they reach out to? And if you're not on a plan, you're on your own to try to, being able to afford that as well and to support them in that direction as well.
Thanks, Bryce. And Amanda, as that, I'll pass to you just to hear what are, and this may be getting into a little bit more of Parkinson Canada's longer term advocacy strategies around other components like care partners, but what are your thoughts there?
Mm-hmm. No, it's just such great points made by everybody on the panel today. And so we'll definitely be keeping those on the forefront, and care partners are on the forefront and on our minds with everything that we do. I first want to say, outside of, I guess, advocacy, if there are care partners out there that are looking for support or information, please reach out to Parkinson Canada. We do have a number of supports and services in place specifically for care partners. There are virtual support groups. I mean, it's tough that things, aren't in person right now, but we do have a lot of virtual webinars and things that will touch on, some support ideas or things in place for care partners. Reach out to our information and referral line. They can also help support and sort of navigate through, the different parts of the journey of Parkinson's. But I think long-term, it really does go back to those key issues that we covered at the beginning and throughout this session. Actually, if we address those diagnosed wait times and alleviate some of the anxiety that a care partner and the person with Parkinson's are going through, waiting for that diagnosis. Is this what do I have Parkinson's? If we get the person with Parkinson's the specialized care that they need and help them live better, that's going to relieve some of the burden, ease some of the burden of the care partner having to fill those gaps, right? And then the medical expenses piece as well. If we are ensuring that people with Parkinson's and their families are having to pay less out of pocket for the support they need and the services they need, then that's going to, of course, ease the burden on the care partner and the entire family. So yeah, on top of everything mentioned by the panel today, I think that's what's on top of mind for us as we move forward into our our larger strategy next year.
Thanks, Amanda. And I'll share that if you are looking to get in touch with our information and referral, you can reach us at info@parkinson.ca, and we will share in the follow-up email from this webinar the phone number and again that email address for any of your questions, including the component around disability tax credits. It's something that Ian had mentioned, but also a question that had come in. So if you are looking for information about tax credits and grants available to care partners, the one piece that we do have for that is that there is a disability tax credit, and something that we want to make sure that you have that information for. There have been a number of questions that have come in, some of them before the webinar took place, questions around how do we get quicker diagnosis wait times in the Maritimes? How do we improve physiotherapy access for Parkinson clients in long-term care? Questions around the reality of access to MDS muscle disorder specialists being limited for individuals who live outside urban centers. And you've heard that from some of the stories today as well. How can we advocate for those improved services and realities? And again, this all goes back to reaching out to your candidates, and after the election, reaching out to your elected officials. Let them know that you are in their riding and that you have a powerful story and one that they should be paying attention to, and that this is not your experience alone, but this is being experienced by 100,000 other people across the country, with growing numbers and the need for some importance there. So I did want to just touch briefly on some of those questions that had come in as well. Sonia, I have a specific question back to you and the PD Avengers. The question was, how do people get involved with the PD Avengers, and what role did they have in something like a Canadian federal election, if anything?
Thank you for that. PD Avengers is easy to join. You just go to pdavengers.com and you can sign up from there. As I said, we're not going to ask for any money. That's not what we do. We just amplify voices. We make connections. We collaborate with other organizations to amplify their existing programs and try and bring everyone to collaborate together, because unfortunately, because people work in silos, there is sometimes a duplication of resource usage, and most importantly, that takes up time, which again, we don't have time to waste. So just going on to pdavengers.com, you can sign up. There's I mentioned the wellness, advocacy, and research. There's different committees that you can get involved with, different working groups. Right now we have a working group on women and PD, because very little is actually known about Parkinson's disease, how it differs in women. We have one on equity in medication access in Africa. We have one on pesticide usage and its correlation with Parkinson's disease. And we have one on the World Parkinson Day, getting it recognized by the UN, and the campaign that we can, global campaign that we can organize. So, I mean, there's lots of different ways to get involved. You can get involved as little as you want or as much as you want. But if you just go to pdavengers.com, you can sign up there, or go to my one website, unshakablemd.com, and you can reach me there through email if I can be of any help in particular.
Thanks, Sonia. Amanda, I have a question specific to you. And this is coming from Sue this afternoon, who is looking to make an appointment with her local MP regarding the availability of disability housing in, oh, sorry, I just lost it there, in her area, which is an issue that concerns her, and part of the reality and complexities of the intersection of other challenges for living with Parkinson's. Is there anything that you can advise her that she can make use of when speaking to him?
I think the best thing actually for Sue and for anybody that's looking to advocate with their local MP on an issue, MPP on an issue such as this, is to reach out so we can figure out how we can support you better. I would need to know a little bit more information about where you reside, just so I can see if there's any local supports or other things that are available in the community, and maybe a little bit background on who the MPP is and what their, the issues that they have on their forefront and that are important to them. So just, I think for more sort of the nuanced issues like that, definitely reach out to myself, reach out to Parkinson Canada Advocacy team, public affairs team, and we can see what we can do to pull some more information about those local issues.
Thanks, Amanda. A final question that we have that has come in that I'll use before wrapping up is that a Pharmacare plan would go a long way in assisting the cost of prescription medications. When is this going to happen? And I had a few caveats to that, and I'll open it if Amanda or anyone else had some thoughts to share. First being that there is a lot happening in this election and around conversations around healthcare and realities, Pharmacare. Different parties are putting out their platforms, and we encourage all of you to educate yourselves to learn about those platforms. As a nonprofit charity, Parkinson Canada has no affiliation or recommendation or guidance to any party or platform. And so we do encourage you to do your own research and vote with that in mind. But absolutely, that is one of the things that is being talked about today. And I know none of us on the call are political pundits or experts, so we can't dive into that issue, but I did want to acknowledge the question.
Cameron,
before wrapping up, yes,
I'd like to say something. I lost my power and I had to come back.
Sure.
And Margaret had asked a question about not being computer savvy and how do I get information. One of the things I've done, and again, is I've talked to my movement disorder specialist and given my name out there, and he's referred me to a couple of other people to call me and find out about their Parkinson's. And another thing I would say to Margaret was don't be embarrassed by your Parkinson's. Be out in the community with it. Talk about it, and that's how you find other people that can now relate to you. It's when you hide from your Parkinson's that it's hard to find help. If you're out there exposing yourself and your Parkinson's to the public, it's very easy to find help.
Thanks, Ian. And those are probably some excellent thoughts to wrap up with. So I appreciate that. I think that really embodies the spirit of sharing your story and the power that each of you have to make a difference for everyone else across the country also affected with Parkinson's. Thank you again to everyone who has joined us, to Dr. Sonia Mather, Jessica, Bryce, and Ian. Each of your contributions have been fantastic, and just again emphasizing the story and the motivation and the realities behind why we do what we do, and keeping that center to everything at Parkinson Canada. Have a wonderful afternoon. Spend some time on parkinson.ca/election and get your voice heard. #PrioritizePD, #Priorons Parkinson. Thank you and goodbye.